Hello friends, I am Dr. Amit Arora. I am a specialist neurologist working at Aster Al Muteena DMPC clinic. Today I will be talking about stroke and hypertension, that is high blood pressure. Stroke, as we know, is an important cause of morbidity, mortality, long-term functional disability. It's a cause of so many memory issues, and it is equally difficult for the caregiver also. Hypertension or high blood pressure is the most common silent killer which can cause stroke. A recent study has shown that around 50 to 60% of patients with ischemic stroke had high blood pressure as the risk factor, and around 30% of relative risk reduction of stroke can be done just by treating hypertension. So I will just brief about the stroke. There are two types of stroke. There is an ischemic stroke in which there is a blockage of blood vessel inside the brain, and there is a hemorrhagic stroke in which there is a bleeding inside the brain. So hypertension or high blood pressure, by putting a strain on the vessels, it damages the arteries and it produces or increases the risk of both these types of stroke. So regular BP checkup is the most important factor in the prevention of stroke. The important clinical manifestations of hypertension or high blood pressure can be headache, it can be palpitations, it can be even a breathing discomfort also. There are various medications for the treatment of hypertension which can be tailored according to need of the patient by the doctor who is treating the patient. But equally important is that these medication has to be taken regularly. There are various lifestyle modifications which has to be done apart from the pharmacological treatment of hypertension. That is, you should cut down on excessive salt and fatty foods. There has to be a regular physical exercise. You have to cut down on excessive smoking and alcohol, and you have to increase the amount of fruits and vegetables to decrease the risk factor of hypertension which can cause stroke. We are having this recent campaign on World Hypertension Day by Emirates Neurological Society and UAE Stroke Support Chapter, in which we want to raise awareness about hypertension and stroke, to build more awareness among people so that we can diagnose more people and then we can help them in preventing stroke.